Hi, my name is Karim Mostafa, and currently I'm a resident radiologist at the University Hospital of Schleswig-Holstein in Kiel, Germany. So the background for this paper was, it was meant as an introduction for me into clinical scientific research. And we are a large center and we perform a lot of liver interventions. And per year we do about 50 TIPS procedures. And as we all know, sometimes they don't work. So over the years, we gathered quite a number of DIPS procedures as well. So there was between 2016 and 2020, we had 8 DIPS procedures, which are pretty rare. And we performed them percutaneously and not with the endovascular ultrasound. And therefore, we decided to review those 8 cases and make a paper out of it. Sometimes it happens that TIPS procedures are not feasible or that the TIPS tract cannot be created. And then there are only limited alternatives except for another effort in attempting to achieve the TIPS tract. But the DIPS procedure, it is known, but it is not very widely used because you need endovascular ultrasound for it. However, in the technique that we published, we can perform the procedure percutaneously. So we can do it with percutaneous ultrasound. And that makes the procedure a lot easier and a lot less lengthy, and also by some bit a bit cheaper because you do not need the sophisticated endovascular ultrasound probes. And in the paper, we put a lot of figures and also a table where we explain the exact steps of the procedure and tips and tricks for every step of the procedure. So that may be quite helpful for others. So for patients, this our research shows that there is an alternative method for portal venous decompression in case a TIPS procedure is not feasible. And this is a benefit for patients as well as in an acute and an elective setting, because we've just given them another interventional therapeutic option. Like the treating doctors, they now have another interventional therapeutic option in case that's not feasible. And the indications for the DIPS placement are the same as for TIPS. So the therapy refractory ascites mainly, and also in the setting of acute gastrointestinal bleeding that cannot be stopped in any other way, to name only the most important ones. And now with this paper, we've basically giving an alternative method that does not need the sophisticated endovascular ultrasound, but can be done percutaneously, so maybe easier. So that maybe that can be used as a bailout strategy in some cases then.